Hello, and thank you for joining our presentation. First, I'd like to introduce our team of co-presenters from Elsevier. My name is Christine Govia, and I'm the Vice President of Applied Learning Sciences. Mamta Shah is also joining us. She is a learning scientist, and Ben Babcock is a psychometrician. I'm going to kick things off with the first section of our presentation to provide a little bit of background, discuss existing research, and our research objectives and questions. Nursing programs seek to enhance both the quality and quantity of nursing students' experiences within clinical simulation labs to help prepare them for the complexities that they will face within the nursing profession. Meanwhile, many programs continue to face ongoing challenges in providing students with relevant and realistic clinical scenarios and experiences, while also being challenged by being able to successfully prepare them to practice as entry-level nurses. Simulations have been widely used in nursing, and there has also been an increased use of immersive technologies, such as VR simulations in nursing education. And we've also seen a surge in research on the effectiveness of VR simulations. In addition to the growing research that I just mentioned on the effectiveness of VR simulations, emerging studies have also suggested that nursing students have reported high levels of satisfaction and also positive learning experiences. And we have also seen a positive impact of VR simulations for many learning outcomes. In higher education, a great deal of research has demonstrated that self-efficacy is positively associated with college student success. In nursing education, self-efficacy of students has been studied mostly within digital simulation environments for clinical experiences. And researchers have reported increased self-efficacy, but there are some mixed findings. Self-efficacy has also been recognized as a predictor of academic success in nursing education. And this really indicates that student self-efficacy expectations had a positive effect on NCLEX outcomes. The main objective of our study was to test the effectiveness of SLS with VR with both nursing faculty and undergraduate nursing students.
This examination is situated in a larger 7-week quasi-experimental study designed to investigate the effectiveness of simulation learning system with virtual reality. In this paper, the first research question aligns with the goal of establishing a baseline. We attempt to understand students' experiences of learning in VR simulations by examining their self-reported responses about what they enjoyed while participating in SLS with VR simulation scenarios. The second research question aligns with the goals of assessing learning outcomes. We examine changes in students' ratings on pre- and post-study surveys to assess whether participating in SLS with VR simulations impacted their perceptions about becoming competent to participate in clinical situations. Convenience sampling was employed to seek participation from undergraduate nursing programs in the United States. A total of 223 first and second year students and 13 faculty participated in the study from 6 nursing institutions. 60% students had no experience with VR, 30% had beginner level experience, and 8% reported having competent level experience. Simulation learning system with virtual reality, or SLS with VR, is a curricular ecosystem that enables nursing schools to provide undergraduate students with immersive clinical experiences alongside traditional simulation experiences. The paper describes the physical setup, the technological features, pedagogical characteristics, and embedded content of SLS with VR in greater detail. For this study, faculty could choose the scenarios they wanted to facilitate and the students they wanted to include in each session and their role assignments. However, all faculty were required to facilitate scenarios using the best practices of clinical simulation education. That is, conduct a pre-briefing, facilitate a simulation experience, and facilitate a debriefing. Of the 44 SLS with VR scenarios that were available across multiple content areas during the study, 18 scenarios from community, fundamentals, maternity, medical surgical, and pediatric disciplines were used across the 6 institutions. To examine students' experiences in VR, we analyzed students' responses on the post-survey question, what did you enjoy while participating in SLS with VR? Self-efficacy was measured through variables such as understanding of content, making clinical judgments, providing individual patient care, functioning as a member of healthcare team, promoting safety for patient, self, and others, and identifying factors that influences quality of care. Evidence about the impact of immersive VR on nursing students' experiences and clinical readiness is still emerging. Hence, thematic analyses a technique that affords an exploratory orientation, was a relevant analytical choice for our study. Specifically, we adopted an inductive approach to identify, analyze, and report patterns embedded throughout the data obtained from students' open-ended responses. Two themes emerged from students' responses on what they enjoyed while participating in SLS with VR. First, students reported that they experienced a heightened sense of engagement in SLS with VR simulations. They described scenarios as immersive and interactive, evoking a strong sense of presence and realism, and offering multimodal stimuli and immediate feedback to learners. For instance, one student said, "I enjoyed that the patient and wife were interactive, as well as being able to actually draw up insulin, check blood sugar, and feel pulses. I loved that I was able to hear heart and lung sounds as well." Second, students reported that SLS with VR afforded them with opportunities to role-play as nurses in authentic scenarios and practice social, cognitive, and psychomotor skills. Students described several encounters like patient and family interactions, working with an interprofessional team of peers and virtual characters, and performing nursing actions in a safe environment. For instance, another student said, "I enjoyed the experience of working with a patient and family member while working as a team with my partner. It helped us work as a team while caring for a patient and interacting with family as well, which I feel is a huge aspect in patient care."
We wanted to see if participation in the VR activity had an impact on student self-efficacy. In order to measure this, we asked 6 self-efficacy questions both before and after participation in the VR experience to see whether the experience had an impact to change student ratings. We looked at those that had responded to the second, third, and fourth options on the 5-point scale. Those were the options where you could either change by going up or change by going down, as opposed to the ends where you could only change in one direction. For the analysis, we used a randomization style test because our data, our different scores, were non-normal and thus violated the assumption of the paired samples t-test. With this randomization style test, we took each individual person's scores and randomly selected whether the first score that they gave actually came first or second. So we mixed up the pairs. We then did this for a large number of replications and looked at the proportion of students whose ratings improved in order to get a null distribution to compare to our original data to see if the proportion of students who gave higher ratings was higher than that of statistical chance. The results, what we can see is that the proportion of students or percentage of students whose rating increased were definitely higher than ratings decreased. Certainly a lot of students remain unchanged. That increase, however, for all 6 questions was statistically significant at the 0.05 level. And so it does appear that participation in the VR simulation has an impact.
To recap, the purpose of this study was to examine nursing students' experiences with SLS with VR. We also assessed the change in their self-efficacy for clinical competencies. This study provides evidence that participation in SLS with VR can improve nursing students' self-efficacy, engage them in authentic experiences, and promote a heightened sense of engagement. I'd like to close with several key implications for practice. First, nursing educators may recognize opportunities for facilitating VR simulations throughout students' undergraduate education, while also introducing them as early as freshman year. Second, VR simulations can be applied across multiple content areas for facilitating exposure to unique clinical situations and enabling them to practice with diverse cognitive, social, psychomotor skills. Third, adopting VR simulations at scale can address the changing nursing landscape and can enhance both healthcare quality and safety. And that brings us to the end of the presentation. Thank you so much for your interest and attention.